So, good afternoon, sir. I am Nurse Audrey from our Fatima University. So, today po, we will be assessing your abdomen. So, before assessing your abdomen, I would ask a series of questions po for interview. Is that okay with you? Okay. Before we start with the assessment, let me sanitize first. Okay, sir. For your current symptoms, is there any abdominal pain?
Wala naman.
Okay. So, for your past history po, meron po ba kayong previous history ng abdominal surgery, trauma, injury, or medications?
Wala po.
Do you have any history of previous abdominal pain and treatment?
Wala rin po.
Meron kayong past history na result ng any lab work or gastrointestinal studies?
Wala po.
So, sa family history nyo naman po, sa stomach, meron po ba kayong family history na stomach, colon, or liver cancer?
Wala po.
Do you experience any abdominal pain, appendicitis, colitis, bleeding, or hemorrhoids? Okay. Next, sa lifestyle and health practices po, nagsasmoke po ba kayo?
Hindi po.
Umiinom po ba kayo?
Hindi rin po.
Sa food and drink po, ano po yung mga kumain nyo this past 24 hours?
Rice, kapang po.
Okay. Next, did you use antacids po?
Hindi rin po.
Do you use any medication? How about your fluid intake po? Nag-water na po ba kayo? And ilang glass po?
Ani.
Nag-exercise po ba?
Opo.
Ano po yung cause of stress in life nyo na nakaka-affect sa pagkain nyo or sa pagdumi?
Wala naman.
So, sa past actions with abdominal pain problems po, meron po ba?
Wala rin.
Okay, sir. Now we will start po with the assessment. So, in assessing the patient's abdomen, we will use the method of IPAPEA, which stands for inspection, auscultation, palpation, and percussion. So, why would we use the percussion last? Because it can alter vowel sounds that we will use for palpation. Okay, sir? So now, sir, we will start po with assessment. Higa po tayo. So, itataas ko po yung part ng damit niyo sa may abdomen. Is that okay?
Okay, sir.
So now, I will proceed on inspecting the abdomen of the patient. So, sir, kindly breathe in po for me. Then breathe out. Okay. Okay, sir. So, for the skin po, normal color. Sa vascularity, normal din. I didn't see any striae or scars and lesions. Sa umbilicus naman po natin, normal naman po lahat. Yung color, yung location, and the contour, it's all normal. Sa contour of the abdomen, normal din po. Symmetry is normal din po. Inline naman po siya. Sa abdominal movement po kanina, while you were inhaling and exhaling, okay naman po siya. For the aortic pulsations and peristaltic waves, okay rin po, normal. Next is, I would auscultate po for your bowel sounds, noting intensity, pitch, and frequency. I would also auscultate for your vascular sounds and friction drums. So, using the stethoscope, I will assess the abdomen of the patient by auscultation. for the bowel sounds of the patients, all is normal naman. But if you don't hear any sounds, it is advised that you listen for at least 5 minutes to hear and focus on the bowel sounds. So, sir, for your bowel sounds, the intensity, pitch, and frequency, normal naman po. Next, for the vascular sounds and friction rubs, yung ginawa ko kanina, normal din. So, now I would percuss po your abdomen for tone, percuss the liver, percuss the spleen, and perform a blunt percussion on the liver and the kidneys. So, now, sir, I would be percussing your abdomen for tone, the liver, and the spleen. So, for your abdomen, okay naman po. Sa liver po natin. Okay, sa spleen naman po. Okay naman po, sir. So, normal naman po yung abdomen natin. I didn't feel any lumps sa liver and spleen. So, now po, I will perform a blunt percussion on the liver and kidneys, then perform a light palpation, noting the tenderness, guarding all quadrants. So, now I will perform a blunt percussion po. Okay. So, normal naman po, nagba-bounce back po yung skin natin when I did the percussion. Ayos na po. Now we will continue the assessment by palpating the umbilicus. Okay, sir, normal naman po yung umbilicus natin. Next is palpating the aorta. Okay, the aorta and umbilicus are both normal. So, next po is palpating the liver and the spleen. So, this is the liver. So, next is palpating the spleen. So, on the consistency and tenderness po of your liver and spleen, normal naman po. Wala naman po akong kitang any lumps or lesions. So, after palpating for the liver and the spleen, I would now palpate for the patient's kidneys. So, sir, okay naman po yung kidneys natin, normal. And the last one to palpate is the patient's urinary bladder. So, sir, is it okay po? Okay, sir. Well, I was palpating your kidneys, spleen, liver, and urinary bladder. Wala naman po akong nakitang any lumps or lesions that would indicate that the patient's abdomen is normal. So, now we would proceed on performing the test for shifting dullness. So, how do we perform the test on shifting dullness? We would percuss the client's abdomen from the side to the center and look for dullness in the fluid inside of the patient's abdomen. So, upon performing the test for shifting dullness on the patient, I noted that the patient doesn't have any fluid dullness on the abdomen. So now we will move on the fluid wave test. So for the fluid wave test, I would ask the patient to please put his arm on the midline on the midline of your abdomen. So when the patient's hand is on the midline of his abdomen, I would tap the right flank and I would tap the right flank and inspect for wave, fluid wave. Okay. So, sir, pakibaba na po. So, upon inspecting the client using the fluid wave test, the client is normal and the fluid on his abdomen is normal. So, now we will perform the ballotment test. So, by doing the ballotment test, I would ask the patient's permission to touch again his body. So, sir, is it okay po if I do the ballotment test to you? So, what I will do po is put on a hand under your abdomen and the other one here pressing it. So, now you will do deep breaths po, okay? Okay, sir? Okay, can you do a deep breath po for me? Okay, sir? Again po. Okay? Thank you. So,
Well, in that case, you should place your left arm to the patient's side before the people.
So, while I was doing the ballotment test to the patient, I noted that I didn't find or I didn't palpated any So while performing the ballotment test, I noted that I didn't see or felt any lumps in the area where I did the ballotment test. So this indicates that the patient is normal and I don't see any signs of tumors or lumps on his abdomen. Now I will perform a test for appendicitis. So now I would rebound for tenderness. So what I would do is to percuss, then let go, percuss, and let go. So now the patient is normal. But however, when the patient have an appendicitis, what I would do is look for the navel and the ASIS to determine the McBurney's point.
It is roughly halfway between those two landmarks. Place your finger midway between the ASIs on the right side and let go quickly. And patients with appendicitis will often report a positive pain.
So, however, when the patient has appendicitis, what nurses usually do is to locate the navel and the ISIS and then point it and then press. So patients with appendicitis would show positive symptoms of distress when nurses pushes this part of the abdomen.
On that rebound testing.
So that would be all for the abdomen assessment.